Maybe I need your help.
Okay, ma'am.
Yeah, you can share for me and then I will tell you. Yeah. But now I cannot dismiss the page. What should I do? Can't share your screen, I know that, but I try to cross the message in front of my screen, but it doesn't. Cancel. Okay. Dismiss. Okay, that's good.
I guess we can start our workshop now.
Okay.
Okay, ma'am. Let me host you. Good evening, everyone. Our esteemed guests and respected participants, a very welcome to all of you. It is truly a pleasure to have you here for this insightful and enriching session on Introduction to Evidence-Based Practice, Bridging Research and Real-World Applications, organized by the Bangladesh Institute of Innovative Health Research, BIIHR. Before we begin, let me take a moment to introduce BIIHR. The Bangladesh Institute of Innovative Health Research is an emerging non-profit, student-led and research-based organization in Bangladesh. Founded on November 23, 2023, BIIHR is dedicated to cultivating a strong research culture, particularly among undergrad students. BIIHR is actively arranging research-based trainings, programs, and providing valuable support in thesis writing, research proposal writings, manuscript preparations, data collection, and data analysis. Our goal is to empower young researchers with the skills and knowledge they need to excel in the field of health research. Today's workshop is a part of this ongoing commitment to fostering evidence based practice and bridging research with real world applications. To guide us through this important topic, we are honored to have with us a distinguished expert in the field, Dr. Patraporn Vatrasakun. Dr. Vatrasakun is an honorable advisor at the BIIHR. She is a professor of mental health and psychiatric nursing at the Faculty of Nursing, Chiang Mai University, Thailand. Additionally, she serves as the director of the Thailand Center for Evidence-Based Healthcare, a JBI Center for Excellence. With her vast experience and expertise in mental health, psychiatric nursing, and evidence-based healthcare, she will provide us with valuable insights on how to bridge research and real-world applications. Please join me in giving a warm welcome to Dr. Patrapon Vatrasakun. Ma'am, we can hear you. You can start our this share knowledgeable and engaging workshop you are going to present us.
Okay, thank you so much for your introduction, Faisal. How about everyone? I would like to see you guys. I don't want to talk with your profile page. Can you turn on your camera? That would be nicer to see you guys. Otherwise, I will turn off my camera as well. Can I see? What is it? Can
Yeah,
I
ma'am.
see? Oh, it's not convenient or what? Oh, what should I do? How come I cannot go to the big screen now? So what is the software that you use right now?
Ma'am, I am using now Google Meet.
Google Meet? I'm not familiar with this program. Uh, so maybe if we have next time, we should use my Zoom ID, okay?
Okay,
So
ma'am.
I can give you the Zoom ID. I don't know how to click on the whole now. So did you? Oh, you are the one who control the screen. Is that correct, Faisal?
Yeah, ma'am. But I have added you as a co-host, so you can control it.
No, but I cannot. So now you share the screen.
Yeah,
Can I?
ma'am.
How about the other? So can you introduce yourself to me? So you are all the
Ma'am.
master degree student or what?
I'm a current student at Jagannath University. I'm studying psychology, and additionally, I am serving as a program lead as at BIIHR.
Mm-hmm. Okay. How about the Sanjana? They are all there, or they just join in passively, or what? Hello. How about the other student? They are at home or what? I don't know this activity well. So what this is Faisal? So everyone join from home.
Yeah, ma'am. Most of them are from joining home, but I think they are uncomfortable to turn on their video.
Oh, so no introduction.
Okay.
I was in Names. Okay, Rebecca, thank you. Where is Names?
Uh, she was actually saying that she was attending her prayer.
Mm,
Yeah, Rebecca
okay.
Sultana.
Hello, ma'am. How are you?
Hi. Good, I'm good. How about yourself?
I am also good. Actually, I was in my prayer, so I missed what you said. That's why I thought you are asking some questions, or you
No,
are interested to introduce with us in video call. Am I right?
no, I just want everyone to turn on your camera. Okay. Normally when I speak over live or over the internet, everyone turn on the camera. I'm not familiar to talk with your profile pic like this. Yeah, that is my first time.
Okay, I will fulfill your wish or fulfill your aspiration. I am just going to open my video option. Okay,
Say again, please.
I am going to open my video.
Yeah, yeah, that's
Okay,
good. Everyone, please. Everyone, please. And introduce yourself to me. I would like to encourage you to do that. That is an honor, you know? Yes, please. So normally, if we have a Zoom meeting or anything, you need to turn on your camera to honor the speaker. Please, everyone. Hello, Brismia. Okay, so can you introduce
Hi.
yourself? Yes.
Uh, Hi, I am Vismi Islam Tamanna.
Hi, nice to meet you. Are you second year or first year?
I am third year. I'm in
The
third
third
year.
year.
Yeah.
Okay, that's good. What is
Yeah.
your area? That's very good.
Yeah. Nice meeting you. Nice to meeting you too.
Yes, what is your area of interest? Area of your research?
Oh, mm, I'm a zoology student, so my passion to be a researcher on animal.
On animal.
Yep.
Okay, okay, that's good. So you have to be like what? The widget, right? Okay, hi Rebecca. Okay, how about Sanjana? How about Mukta? How about yourself? Yourself?
Hello,
Okay.
ma'am.
Hi.
Sorry, ma'am. I just face some difficulties to join with you uh, via video. So I'm extremely sorry for that. Let me introduce myself. I myself Mukta Barmon.
Okay.
I am pursuing my Bachelor of Science or undergraduate in psychology at Jagannath University, Dhaka. And my research interest is the mental health and public health also. And I am super excited to enjoy your sessions.
Thank you. Okay, thank you. How about you, Afrina?
Hello, ma'am. How are you?
Hello. Good. How are you?
Yes, I'm fine. Ma'am, I'm Afrina Kausar. Currently, I'm just completing my post-graduation from the University of Chittagong from the Department of Geography and Environmental Studies. Now, present, I'm joining at BIIHR as a junior research assistant.
That's good. Welcome to my talk. Okay. So how about the 10 others? What is it? Faisal, that's the 10 others on the screen, which mean that they join together at once together or what?
I request everyone to turn on your video cameras as our instructor is asking for that.
Okay. And then now, okay. All right. So can you share my screen now? Or maybe I can try. Okay, maybe I can try. Share now. That will let you take over from BIIHR contact as the main presenter. So can I share now?
Yeah, ma'am, you can share.
Okay, that's good. And allow to share window, allow to share the screen. Okay, click to. So now, but I cannot click on my. That's weird. I cannot click on my presentation. So what should I do here? Faisal, maybe I need your help. I cannot click. Click to exit full screen. Share entire screen. Okay. And then
Yeah, ma'am.
can you see it now?
Yeah, ma'am, we can share.
You can see my screen now?
Yeah, ma'am, we are seeing
Okay,
this.
that's good. Okay, that's good then. All right. Okay. Hello everyone. It's okay. So if you don't want to turn on your camera, okay. So this is the new thing that I should learn from you. So maybe you are so shy. All right. Okay. So I'm glad to introduce about the evidence-based practice. The concept that is worldwide famous right now, acceptable worldwide, that everyone need to know about the evidence-based practice. If someone doesn't know that, it's kind of like you miss the boat. Okay. And then to do the evidence-based practice, like it's kind of like the tools or the concept that try to bridge the gap between the research and the practice. So that's why it's like, from the title, it's like bridging the research and real world application. So we will know that how to use the concept of the evidence-based practice to enhance our practice in whatever your area. Okay, you are a psychologist, you are maybe the doctor or maybe the nurse. I don't know your background because we don't have time to introduce, and it's kind of you reluctant to introduce yourself to me. Okay, it's okay. So what is the evidence-based practice? Because we have only 1 hour, right? I don't want to waste my time. Yeah, because otherwise we won't have time to cover this. And Faisal, how come I can see everyone as well? I cannot see everyone while I share the screen. So can
Ma'am,
I?
this is default option for the Google Meet. When you share, you can't see the others.
Do I need to go somewhere else?
No, ma'am.
So what should I
It's
do then?
it's default options.
Oh, it's okay. Okay, I cannot see you guys right now. So what is the default that I should use?
Ma'am, if we arrange this session in June, then you could have see others.
If you share the screen by yourself, right?
Yeah, ma'am.
Um, maybe no, it's okay. I would like to share by myself because I need to be like interactive. Okay, so it's okay. Yeah. Maybe when I finish, I can stop sharing the screen, and then I can see you guys. Okay. And at that time, I would like to ask your kindness to turn on your camera for me at that time. Okay. So now I would like to talk about the concept. What is the evidence-based healthcare? So actually, this term are interchangeable right now with the evidence-based practice. So you may heard, you may hear about the evidence-based practice, and some textbook maybe they call the evidence-based healthcare, but actually it's the same. Okay, it's kind of like it's interchangeable. Okay, so it is the evidence-based healthcare is the process is a healthcare process when the clinician at the point of care before they are going to provide care for their target population. So they need to consider the three things together. The first one is about the evidence base that available for them. So normally it is a research result. Okay, that is about the intervention that they are going to provide to their target population. So they need to have the one of the available evidence, and then they need to, before delivering the care or the intervention, they need to integrate their clinical expertise into that, and also the patient preference, how would it goes with their preference or their belief or their culture. And also they need to think about the feasibility, the context, okay, the feasibility, appropriateness, meaningfulness of that intervention, okay, at the point of care before they are going to make decision to select any intervention to provide care for their target population. Okay, so that is what the evidence-based healthcare means. Okay, and the actually, like I said before, we use evidence-based practice, right? And then the terminology right now, so it's evolving. So first, the doctor, the medicine, school of medicine, they start this concept. So they call the evidence-based medicine. Okay. And then right now is try to incorporate all of the professional together, because when the nurse use, so we are going to use like evidence-based nursing, and when the pharmacy use, they call evidence-based pharmacy, and maybe psychology, they also call like evidence-based psychology. So that's why right now is incorporate together for the healthcare professional. So that's why we use evidence-based healthcare as a one common terminology together. Okay. And so this is the concept, the overall concept that the components of evidence-based practice or evidence-based healthcare. So you need to have, first of all, you need to have the research evidence or the best available evidence. So I'm going to talk about that. What does it mean later? So, and then, so once you have the evidence, and then you need to integrate with your clinical expertise to use it. Otherwise, if the research saying that CBT is best and it can increase the depression, but you don't know how to do the CBT, so it doesn't matter, right? So that's why everything that you got from the evidence, so you need to be expert to use it. Okay, to be knowledgeable and have the skill to use it to make decision in the clinical setting. And then you need to think about the patient's value and preference. For example, is it congruent with their belief, or is not against their cultural background or anything like that? Why that we need to consider this thing? Because otherwise, everything that happened in the hospital, we will be ended in the hospital. because it's not congruent with their value or belief. So that's why they stop doing that. They stop to conform that. So that is the reason why, the in the clinical setting we need to think about that, because otherwise it is also, that they are going to relapse and they are going to go back, whatever that we taught them in the hospital, so they not continue to do that when they are going home to live with their family. So that's why we need to think about the context as well, the feasibility, the appropriateness for their culture, for their belief, for their religion, everything, okay, to make it sustainable. So that's why, if we consider 3 and 4 things about the concept in the at the point of care when they make decision, and then we just try to modify the evidence that has been proved that, had been proved from the research already. So if we use that and integrate every components together, that is going to enhance the positive outcome, both the process outcome that is going to make them satisfied for the healthcare provider, and also provide the clinical important outcome for the patient or for their target population. Okay. So those are the components for the evidence-based healthcare or evidence-based practice. And then the first thing that really went here is about your research, because if you are going to do the primary research, that is the research evidence here that we are going to produce, and I will talk about that later, how that related to, in this concept. Okay. And before that, I would like to mention about the history of the systematic review, because right now, to do the evidence-based healthcare, like the research evidence here, it doesn't mean that you need to select or rely on only one research study. So you need to do the systematic review, because only one single study is not enough, to use it. All right. So, for example, if Faisal, you are a psychologist, and then, okay, so you search and then you find one mega trial saying that CBT is the best. CBT can decrease the depression in women with breast cancer survival, for example, and then that is a mega trial, like, from the RCT, and it is produced the statistical significance between people who receive the CBT and people who doesn't receive the CBT. And then you say that you hold this research, and then you say that, see, CBT is the best. So this is the best available evidence that I got. And then your friend, your colleagues, another person who is psychologist, and then she got another, she also searched, and then she got another mega trial and saying that, no, it's not statistically significant between people who receive CBT and people who receive normal care or usual care, or people who receive the basic counseling. So both of you just against each other, a fight to each other, because you rely on the single research that you review that is a good research, is RCT, is control everything. So you can see that is a problem right now. And that's why right now we not rely on only one single study. If we talk about the research evidence or best available evidence here, which means it's a combined result from the systematic review, not combined like the other. It should be systematic review. Okay. So the history of the systematic review that started from Cochrane, Dr. Cochrane. I believe that you know the Cochrane Library. So he's the one that they salute and name the library or the organization as a Cochrane. And his first name is Aki. Okay. And he is the obstetric doctor, I think. And then at that time, he's the one who started to mention that to treat the patient. How come, why don't we, we use or rely on the information from the RCT, but it is not only the RCT. It should be something that's summary or combined together. So that's why he's the first one who initiate about how to do the systematic review. And at that time, they call that to do meta-analysis. But right now, meta-analysis we call for, people who try to combine the research result together, right? But right now, the meta-analysis is only the procedure, the statistically procedure to combine the result for the quantitative evidence. And for the qualitative evidence, we call meta-synthesis. So Dr. Cochrane is the first one who started to do that at, I think, Oxford University at that time. That's where he taught at that time. And then he's the one who started to have the database and show people, because the other people just maybe, to change something is hard. So that's why they don't believe, they don't follow him, but he just try to create the database at the Oxford and try to show them that, it's better to provide care based on the systematic review rather than from your expert or from the single study. Okay, and his writing, the well-known writing is about the effectiveness and efficiency, the random reflection on health services in 1972. Okay, and after that, when after Dr. Cochrane initiated the concept of how to do the systematic review, and then Dr. 𝐸𝐵 𝐸𝐵 is the epidemiological doctor. He's based at the McMaster University in Canada, and he's the one who initiated the concept of the evidence-based medicine at that time. Okay, and then his writing is about clinical epidemiology and evidence-based medicine. And then he's the one who initiated this concept that to do the evidence-based practice or evidence-based healthcare, so you need to have like best available evidence, and you need to have clinical expertise, and you need to think about the patient preference. So that is his initiative. Okay. And after that, Professor Alan Pearson, he is the nurse, from actually first he from the UK, and then he moved to Australia. He teach at La Trobe University, and then he moved to University of Adelaide, and then he's established the JBI Center. Okay, and he's the one who deliberate more about how to do the evidence-based healthcare, because he said that, beside the available evidence and clinical practice, expertise and patient preference, you need to think about the context of using the evidence as well. When you are going to implement the evidence, you need to think about the appropriateness, meaningfulness, and the feasibility to implement that evidence. Okay, so the and the effectiveness, this is the most important thing. Okay, and then they call JBI FEM scale. Okay, before you are going to use the research result into the clinical setting. Okay, you need to evaluate the FEM scale. All right. So that's why, right now the evidence-based healthcare is so acceptable worldwide, because when you try to look at the available evidence and before you are going to use it, so you need to screen out for the feasibility, appropriateness, meaningfulness, and effectiveness. So that's why when you use it, to make sure that it is going to lead to the desirable outcome or effective outcome. Okay, and then by using the evidence-based healthcare or evidence-based practice, so that is going to facilitate the sound decision making at the point of care and minimize the risk that is going to happen to the patient and try to weigh between the benefit out of harm, right? So you need to think about that before you are going to use the evidence, before you are going to provide care to your target population. And by using the evidence-based healthcare, that is going to make you, save time, save your energy and the cost of care, because you use the trusted evidence or you use the approved, okay, the tested evidence or trusted, we call trusted evidence, which means that it is effective. Okay, it is effective. It from the sound research. Okay, because you need to evaluate before you are going to use it. So that's why it is going to lead to the clinical outcome and process outcome. So that is going to save time to provide care and save energy, and also, going to give you the clinical outcome, and then that is going to save the length of stay, shorten the length of stay, and save the cost of care. Okay, so I would like to introduce you. Okay, before I go to the GBI evidence-based healthcare, to introduce you about GBI model of the evidence-based healthcare. So do you have any question by the definition and the history of the evidence-based healthcare? Any question before I move on? Because I cannot see you now. Anybody is still there?
Yes, we are here.
Okay. Any question?
No, you can carry on.
Okay. So, all right. Okay. If you don't have any question, it's okay. So we can have a time to discuss at the end. Okay. So, I'm going to talk about the GBI model of evidence-based healthcare. So you can see that actually they have like maybe more than 10 evidence-based healthcare. Okay, 10 model of evidence-based healthcare. So like what the Johns Hopkins, the ESTA model, Iowa model. So they have more model, and then because this one I am collaborate with them, and then so that's why I choose this one to introduce you to you. But you can search and have a self-study and see from the internet that they also have another model for the evidence-based healthcare. Okay, so this one is from GBI. All right, because I'm a director of the GBI Thailand Center, and then we use this model. But actually, I also teach this course for the PhD student here in Chiang Mai University. So the course name Advanced Synthesis and Knowledge Translation. And then we talk about the model of the evidence-based healthcare, the characteristic of each model. So that is very fun. But actually the core concept is is common, that, they try to transfer the knowledge from the research study to the clinical practice. Okay, so you can see from the GBI model of the evidence-based healthcare here. So you can see that the aim, the aim is to have like the global health here, right? So we aim to have the global health, and then you can see the both direction, which mean that it can be the driving force, the driving factors, and also the end of of the outcome, the end of the aim, the ultimate goal that we want to achieve. Okay, so to achieve to the global health, so we need to have the evidence generation. Like you guys, you now are in the master degree or PhD, so you are going to generate the evidence, which means that you are going to do your master degree thesis, master thesis, or dissertation. That is the research, right? So the evidence generation can do through the research, or from the expertise, right? And from the discourse analysis. So that is to generate the evidence. And then right now, can you believe that there are many primary research? We call primary research here, okay? When people generate the evidence, which means that you do mostly, come from the research, right? And then it's primary research. So the RCT, can you believe that by the BMJ? So we have RCT is coming out and published 1 minute per one RCT. You can see that we have many of the evidence out there. But before we are going to use it, we need to synthesize them. Like I said, like Dr. Cochrane saying that, before they are going to treat or they are going to provide the care for the patient. So we need to rely on the the combined result of the RCT, right? So that's why we need this piece of pie. So we need to do the evidence synthesis. That is, to do SR, systematic review, or maybe evidence summary. So some organization will summarize the evidence for you, or develop the guideline for you. So we put the guideline in this under this evidence synthesis, because to develop the guideline, the trustworthiness guideline should be informed from the systematic review. Okay, so you can see that even the guideline, even evidence summary, so they are derived, or they are formed from from the systematic review. So this is the evidence synthesis. Okay, so before we are going to use the research into the practice, so we need to synthesize them to make sure that to do the systematic review, to make sure that all paper that try to explore whatever phenomenon of interest that you have, so they combine result for you, and then you can see the direction, whether it is positive or is not statistically significant. So you don't waste your time to, for example, if the doctor try to find between Sarah and paracetamol, so which one is the best in terms of the cost effectiveness or anything like that. So they are going to try to find the systematic review that compare between between both of them, right? And also, like I use as the example at the beginning, if like for example, Faisal, you want to help people who have the depression, and then you try to find the research study, and then you see you find that the CBT is the gold standard. So you need to synthesize all the primary research that they are conducted to explore or to investigate the effect of the CBT on depression, right? And try to synthesize that, okay? And once you synthesize the evidence, so we need to transfer the evidence. So this is a big gap right now, okay, for people, for clinicians around the world, because it will take before it take 15 years from research into practice. But right now, because of the evidence-based healthcare concept is worldwide accepted, and we try to use it, and we try to shorten the gap from the evidence generation here to the evidence implementation, or to drive to the global health. So now it's shortened into 15 years. And the big gap is, this one, the evidence transfer. If any of you try to search for the systematic review that from the Cochrane Library. So you are going to see that the Cochrane Library, they also have the lay language or consumer language. So that is the way they try to transfer the evidence to lay people. Otherwise, if you try to disseminate your research by publication and then you use the statistical term, for example, CBT is makes statistically significant than people who receive usual care, blah blah blah, something like that. So can you imagine if people, they are in the clinical setting and then they are not like familiar with that term? Okay, so that is another barrier or challenge that right now we try to solve that. So that's why Cochrane Library right now, they try to have the lay language and also JBI as well. So you can see that right now, the systematic review, they have the lay language for the reader. Otherwise, they cannot read the forest plot, right? The meta analysis and meta synthesis. So it doesn't make sense for them, right? People who was not trained by Cochrane or by the JBI or by the Campbell, by the organization who did the systematic review, they don't know how to interpret the result of the systematic review, or they don't know how to use the guideline well. So that's why we need to transfer them into the lay language, okay, by the education, by system integration, or maybe the active dissemination by Facebook, by X, like Twitter and everything, right? And then once you transfer the knowledge, we call that to transfer them into the knowledgeable action. No, action. Knowledgeable action. Okay, that ready to use. Okay, so that's why the model of the evidence-based healthcare, they try to solve the problem of how to transfer the knowledge for people in the clinical setting, because that is going to facilitate them to use and implement the evidence into the practice. Okay, so this, the orange one, the evidence implementation is also the big gap. Like I said before, it took like 7 years from the generation, the evidence, into the implementation. Okay, so can you imagine, like, wearing the helmet right now is come from the epidemiological study when they find out the odd ratio between people who wear the helmet and who won't, and who got the head injury. And then it come out like, people who wear the helmet is more safer, like, big odd ratio more than 5. So that's why, but that's why right now, people, we need to, by the law and regulation, so we need to wear the helmet when you ride the bicycle or ride the motorbike, right? But can you imagine how long does it take from the research on the shelf into the policy maker, like policy level, and into the law and regulation? It take like more than, I think it take like 13 years for the helmet piece of the research. Okay, and another example, like, the research from the vitamin C that prevent no the no another one no another one when before, you can see that they have the, like, one systematic review try to combine the result from the mega trial, the RCT, and then try to produce the odd ratios, the association of people who eat the egg, right? Who eat egg more than 1 egg per day, and then they are more likely to develop the cardiovascular disease, right? And then, especially the yolk right? The yolk, the red egg, right? So that's why, I think maybe 10 years ago, we try to eat only the white egg. We don't eat the yolk one because that is going to increase the our lipid, right? So that's why. So this is a practice that come from the research evidence that sometimes the research mislead us. So people. So that's why we need to do the systematic review to prove that, and then once another systematic review come out that maybe if you don't have the genetic, if you don't have the history of cardiovascular in your family and in your genetics, so you can take, but it is the odd ratio is only 0.0001, something like that, which means no 0.01, so which means 100 people, only one people that are going to develop the cardiovascular disease if they take more than one eggs, boiled eggs, to eat that. Okay, so that's why you need to synthesize the evidence. Don't rely on only one research study. And once you synthesize the evidence, so you need to transfer the knowledge for people in the clinical setting to use it, or maybe lay person to use it, to take care of themselves. That is going to drive to the global health here. Okay, I think I try to cover just one slide. So that's why right now it doesn't mean that you need to generate the evidence if it is out there. So you need to find out and utilize them. Okay. And so, like I said before, the evidence means the expert opinion in case that they lack of the research evidence. For example, like COVID-19 pandemic that we had, 3-4 years ago. So you can see that we don't have the research going on. And at that time, people who did the research on the COVID-19, so they kind of, enhance their availability to publish the research, right? They try to produce or generate the evidence. Okay, and at that time you can see that the WHO tried to rely on the expert opinion when they develop the guideline how to take care of themselves, how to wash their hand. So those are from the expert opinion from the infectious control expert, right? And also, the evidence, mostly is come from the research study. And then within the research study, we have primary research, like I said to you. And then also we have the SRN guideline as the evidence synthesis, or we call the secondary research, right? And so right now, the evidence-based practice is more acceptable, and then it's not synonymous, with the RU or research utilization. I think in 1980 or 1970 or 80, so we use RU a lot. We try to encourage people in the clinical setting, try to use the research to provide care. Only one research, so that's why we use RU. But right now, EBP, we use EBP, so we need to rely on synthesis of the evidence, not only from single study. Okay, so we need to rely on the multiple study or evidence and combine them systematically. We call to do systematic review. Okay. And I talk about the gap of evidence already. Right now, it's shortened to, I think now it's 12 years already that we try to make the good research, from the shelf into the policy level. So we try to shorten that. Okay. And then the big gap is, how to translate the knowledge that we have or the good research that we explore and try to use it, okay, in the clinical setting or in practice. And the most important thing that is, before we are going to use the evidence, we need to critical appraise them and select a good evidence. Because if you select, the low quality of the evidence, like garbage in, garbage out, right, to produce the systematic review. So they are going to mislead people. For example, if you try to look at intervention A and intervention B, and then if you combine the result and saying that intervention A is better than intervention B, and then you recommend people to use intervention A, so that you mislead people, because actually is not statistically significant, something like that. So that's why before using or before combine the result, you need to appraise the evidence. Okay, you need to have the sound study, sound methodology. Okay, so that is the important step to develop the evidence-based innovation before we are going to use it. Okay, and right now many organizations try to facilitate this step. For example, JBI Cochrane, so they have the checklist for you guys to screening the quality of the primary research before you are going to develop the intervention. Okay, so this is the example, like checklist for the case control study, and they have the checklist for you. And if you go by the GBI website, you are for the clinical appraisal, so they are going to produce by the research type or the research methodology. So they have RCT, they have 𝐶𝐳, they have case control study, something like that. So the checklist is different, depends on the type of the study. So you need to select the appropriate one. Okay. And another evidence, also the systematic review, and you know about that. Okay, maybe next time I will talk in detail about the systematic review, the how to conduct that, the step to conduct it, by concept. But so it's a one type of the research. It's research on research when you try to synthesize all of the relevant literature together and combine them, right, by using meta-analysis or meta-synthesis. Okay. And before you are going to do the systematic review, you also need to evaluate the quality of the primary research before you are going to include to your review. Okay. And this is and also if you find the evidence that they are in the form of the systematic review, so you are going to you need to screen whether it is a good systematic review or not. Okay, so they also have the tools to appraise the systematic review. So they have AMSTAR2 and also from the GBI critical appraisal for the systematic review as well. So you can use that to screen out whether the systematic review that you found out it is a good systematic review or not. Okay. And also the CPG or clinical practice guideline, that is another form of the evidence synthesis, right? And then if you find out, you also need to evaluate whether it is a good guideline or not. And then, the grade, okay? The grade center, so that come from grading of recommendation, assessment, development, and evaluation. So that is a framework for people who want to develop the guideline, and also for you guys, if you find the clinical practice guideline and you want to see whether it is a good clinical practice guideline or not before you are going to modify to use it in the clinical setting. And this is a great guideline development checklist. You can go by website and you can see they translate into many of languages. Okay. And we also translate into Thai for Thai people as well. They have Chinese, they have Spanish. Okay. So we use a great approach as well. So this is a tool to evaluate the guidelines. So right now we use Agree to evaluate the guideline. If you are going to use the guideline, in your clinical practice, you need to evaluate whether it is a good guideline or not. Okay, so this is a checklist. from the agree to. Okay, so this is what it's like. So you can go by the website and you type agree. Okay, right now is a second version already, and then they translate into many languages. Okay, for people, for the clinician around the world, before they are going to adapt or develop the guideline. Okay, and I think this is the implementation, right? The last part of the model, that is the evidence implementation. So how to implement the evidence, they also have their step to do that, in every piece of the GBI module. So they also have their own science, okay, their own concept to do that. So you need to evaluate, or we call the situational or context analysis, before and after you implement the evidence. Okay, and this is consideration when you are going to develop the evidence implementation project. Okay, so you need to try to find the evidence and the quality of it. Okay, and it is suitable, localized, or contextualized. Okay, so to think about the context as well. All right, beside the effectiveness, you need to think about the feasibility, appropriateness, and meaningfulness that is going to give to your target population. So this is key elements of the evidence implementation, right? So you need to do the context analysis, whether they need change or not, and what have been done before. Okay, their behavioral practice, do they need a change before and after, and what kind of change that they need, and then you need to find out the evidence, okay, to make change for them. And then after you use the evidence, you need to evaluate that, both the process and clinical outcome. Okay, all right, so this is the key to improve. So the last one, okay, the last one, you can see this is the, I call the best practice cycle. So if whatever area that you are in, you work with animal, you work with people, you are a psychologist or you're a nurse, you're a doctor. So if you work in the clinical setting, so you need to produce the research or generate the evidence, and by using the PICO, right? I'm sure that you know about this PICO, population intervention, comparator, and outcome. Okay, so you need to identify that. Okay, and then if, for example, if you have the clinical problem, so you need to make sure what is it, what is your population, what is intervention that you want to look at, and what is the outcome that you want to make change, and you try to search for the evidence, right? And you need to have the search strategy, because you need to search systematically and try to make sure that the paper that you have is a representative of all paper that investigate on that phenomenon of interest. So that is the key of the totally search strategy, right? And then once you have the evidence, you need to select and critical appraise for their quality. Okay, so maybe you find the evidence that is a primary research or the systematic review form. Okay, and then you need to appraise that, and then once you got the evidence, you can develop the innovation, even the evidence-based innovation, or maybe trustworthiness guideline. And then to do that, you can produce the research innovation, and you can publish one paper already. And for searching here, to try to do the systematic review on yourself, you can have one article by doing the systematic review, and one article by develop the evidence-based innovation. And once you implement and you try to monitoring and everything, clinical quality improvement, you also have the routine research here, like, before and after research, and to evaluate the process outcome, process outcome and clinical outcome here. Okay, and if you know, in the clinical setting, you need to have the clinical audit all the time, whether the innovation that, you know, we develop is work or not, right? And if it doesn't work, you need to find out, you know, what is a gap there and what is the problem. So that's why you need to do the clinical research, you know, by, you know, look at that. So that is the cycle that you are going to go, like produce the evidence and then, you know, synthesize them and develop, you know, innovation project and try to use it in your setting. So that, you know, the cycle is going to bring what consorting together between, you know, evidence synthesis, evidence generation, synthesis, and transfer and implementation, you know, on the cycle. Okay, so those are for the evidence-based practice concept for you guys. Any questions? So how can I close this? How can I, okay, all right.
Thank you so much, Dr. Vadrasekun ma'am, for your enlightening presentation. Now we open the floor for our participants. If you have any queries or any thoughts, you can share by raising your hands, or you can share your thoughts in the chat box.
Ma'am, can you hear me?
Yes, I can.
It was
Yes.
it was an outstanding presentation session. It gave a lot of opportunity to take lesson about evidence-based practice. Could you tell us difference between evidence-informed decision making and evidence-based decision making? Or
Tell
how?
about what?
My next question is, I have two questions. My first question is, could you tell us something about what the difference or distinction between evidence informed decision making versus evidence based decision making? And my second question is, when we generate evidence through rigorous process of research, how we how we transform the evidence to knowledge generation by knowledge transmission.
Oh my God. So what is the second question? Because it's a little bit noisy. So what is your second question?
Sorry, ma'am, I am outside. I am straight. I am
Yeah,
in the
I
road.
understand.
So
Yeah. So
my
what?
second question is, by generating evidence, how we transform evidence into practice through knowledge translation.
Faisal, you need to help me for the second question. So for the first question, evidence informed decision, and what evidence based decision is interchangeable, is the same, which means you make decision based on the evidence. Okay, is that your question?
Ma'am, is it
Yes.
is it difference between evidence informed or evidence based?
Yeah, because when you make decision, if they call evidence-based decision, which means that you make decision on the evidence, based on the evidence, evidence-based decision, and evidence-informed decision, right? It's the same meaning.
Ma'am, in our South Asian perspective, most of the health decisions are taken by the evidence informed because due to the lack of data or information or research, but the Western world they are focusing on evidence based. So, is there any small or big differences between evidence informed or evidence based?
Actually, when you try to do something, you develop something we call evidence-based guideline, evidence-based decision. But when you are going to make decision, I think you evidence inform you, so that is, you know, is transfer more interactive, that you need to look back and try to update the evidence that inform you, okay, to make decision at that moment. Maybe it's a little bit different, okay, when they use the term. But if they use like evidence-based practice, evidence-based decision, which means any decision or any practice, they are going to use the evidence, okay. But to inform you, when is like I said, it's just nuances different. It's like passive when you say that evidence-based practice or evidence-based decision. But if evidence inform decision, which means you look at the update evidence that is inform you to make decision at that time. Is that answer your question?
Okay, ma'am. Thank you. My next question is: most of the policymakers in the different states, they have no idea about how to incorporate the evidence into practice. So, as a policy analyst, how I advise my policymakers to use this evidence into practice?
Yeah, because you know what, even for example, even guideline, if they call evidence-based guideline, which means they develop the guideline based on the evidence, but actually for the guideline, they recommend that you need to um, modify the guideline every 2 years based on the evidence inform you, okay. Or maybe, for example, when we have the COVID-19 pandemic, so you can see that the WHO used the term living guideline. Living guideline means at that time, because they don't have the evidence enough to inform, to develop the guidelines. So that's why they try to use the expert opinion who work with the SARS at that time, right? Or who, the infectious control doctor at that time. So they recommend us to wash the hand, to do everything, to clean the surface of our table, whatever. That is the consensus guideline. And they use that as living guideline, which means that if they have the new evidence, the evidence is going to inform them to modify or adjust their guideline. Okay?
Okay, ma'am. Thank you for your insightful statement.
Okay, you're really welcome. So what is your second question? Is that answer your question?
Oh, yes, ma'am. I'm trying to ask you about if we produce the, if we generate the evidence through systematic review or meta-analysis. For
Uh-huh.
example, the odds ratio of the tobacco and coronary heart disease is 6.5. But how we approach our policymaker, or how we transform the evidence into policy practice through knowledge translation. What could be
Oh,
the component of the knowledge translation, or how we utilize these evidence into policy practice? How?
so you need to include them into the process, because that is the hardest step, try to push or drive to the policy level. So you need to include them as the team at the beginning when you are going to do something new or change something. When you need to have, we call the panel committee and the board committee. So you can see, you can learn by the WHO. They are very clever. So to do the to develop the guideline, they have the panel committee, and also they have the board committee. And for the board committee, they are going to include the power man and the policy level into the committee, because to make them engage. So the engagement from the stakeholder is really important for the evidence-based practice. Otherwise, it's not sustainability and it's not drive to the policy level. So this is a very good and a little bit tricky question here. That is, and then it is going to be very challenges for the all clinician around the world. Yes. So do I answer your question?
Yes, ma'am. Yes, ma'am. Thank you. Thank you for your insightful discussion and statement.
Sure. Okay. I'm glad that I answered your question. I thought that I closed my my camera and I just saw that I opened my camera and then when I talk, I just I have the action when I talk. Okay. Any more question? Who raised hand?
Hemodipa Chaudhary, you can ask your question.
Hello, ma'am. It was nice
Hello.
presentation. Can you hear me
Thank you.
properly?
Say
Hello.
again, please. Yes, I can hear
Yeah. Can
you.
you? Okay.
Yes.
Thank you. It was nice presentation. My question
Thank
was
you.
a little bit tricky. Actually, I'm not from any science or medical background. So
Uh-huh.
far today, what we have learned. So my question is actually that the method or the guideline we have learned today, is this applicable for every domain people who are researcher or like for people who are from social domain or from other, sector, they can also apply your guideline. So far we have learned today actually.
Actually, the guideline is for actually for the clinical setting. Yes. Uh, but I also have the students or the trainee that they come from the higher education, come from another like social, from humanity, people, and because they also try to develop the guideline, and then they can use the step of doing the systematic review because they can combine the result of the research, whatever the research. It doesn't mean that it should be only the health science research, right? If you are in another area, you also benefit by using the step of the systematic review and by using the step of developing the guideline. Yes.
Yeah, I understand completely. Thank you so much for your all the preparations and all. Thank you so much.
Thank you. Any more question? Maybe it's only 15. Okay. Faisal, maybe the last minute, right? We have only 1 hour, right?
Yeah, ma'am. So, is there anyone
Hello,
who have any
hello,
question?
ma'am. I have a
Yeah,
question.
Yeah,
Humayra.
maybe one last question. Okay.
Okay. In cases where there is no strong evidence available, should we rely on expert opinion or traditional practices or emerging but unproven therapies?
Yes, sure. Like I said, the example of the COVID-19, at that time, we don't have the available research evidence. So that's why the WHO, they depend on the expert opinion when they try to develop the guideline at that time, right? And they also use network. They do networking meta analysis when they try to look at another study that from SARS and anything that try to use the evidence that close to the COVID-19, right? Yeah.
Okay, ma'am. I had another question.
Yes.
So, if two high quality studies provide conflicting results, so how do we determine which evidence should guide clinical
So that's
practice?
right. Yeah, that's good question. That's why you need to do the systematic review. Otherwise, you are going to fight to each other. If one of your friend got another one and you got another one, then and they are the RCT, and make a try, and you just really strong on whatever that you have. So that's why right now to develop the guideline or to develop the innovation or anything, so it need to be based on systematic review, not on single study. Okay, because you're not sure that what study that you have in your hands is representative of the all study. For example, like, I did like umbrella review. So you can see that we are more advanced now. We do systematic review on systematic review. So for the CBT, because right now CBT is kind of like the gold standard to, for decreasing the depression. But I do the umbrella review to see that, CBT for the depression, how about CBT for the schizophrenia people, how about CBT for some other, target population, and see the direction of that. So, and for, for your question is primary research. So we cannot rely on only one primary research study, because maybe like, if you find the research from India, so they're saying that CBT is the best and it can produce statistically significant compared to people who got like basic counseling. And from Thailand, they say that no, it's not making the statistically significant at all. So why you waste your time to do CBT? Why you do just the usual care, for example? Okay, this is only the example, right? So that's why we don't rely on only one single research study right now. Okay?
Okay, ma'am, could I ask one last question?
Oh my God, I need to go now. Okay. Okay. All right. So what is
Okay.
it?
Should patient preferences and values have equal weight as randomized control trials in evidence-based practice?
No, patient preference mean if you are going to use the result from the RCT, you need to think about the context, the feasibility, appropriateness, meaningfulness, because the RCT will give you only the effectiveness, right? Only one piece. If you got a very good, research, the robust RCT result, that is going to give you only one component, that is effectiveness. You just make sure, if you do intervention 1, 2, 3, 4, 5, you are going to get the expected outcome. So that is only one piece of the effectiveness. But, before you are going to use the research, you need to think beyond the effectiveness. You need to think the feasibility, that it is practical for your target population, and the appropriateness to their culture, okay, to their background is, and then it will give them a good experience after they're using it. So you need to think about that is the patient preference, Otherwise, they won't conform to that. They won't adhere to that. Like I said, everything that you have done very hard in the hospital, it will be ended in the hospital. Because when they go home, and then they got the relapse, and then once they saw you, ma'am, I cannot do that. How come? I need to work every day. I cannot do whatever that you taught me in the hospital. And also maybe if something that against their belief or against their religious practice, they say that I cannot do that at my home. I need to pray, 3, 5 times a day for the Muslim, right? For Islamic people. So I cannot keep doing that because I need to pray like 5 times a day, something like. So you need to adjust. We call contextualization, or we call from global to local, we call global. Okay, so that's why they have the term global. So you need to think about context bound or contextualization. Okay,
Thank you,
contextualizing.
ma'am.
Sure. All right. Okay. Faisal, I think that's enough. It's
Yeah.
almost half an
So,
hour.
as we come to the end of this insightful session, we would like to express our gratitude to Dr. Valtarasakun for sharing her expertise in the field. We hope our participants also learned something new in this session. So, we think our participants will be able to apply this knowledge into their practices, and this knowledge will be very effective in their future practices. So we
Thank you
also
so much.
thank all our participants for their active participations through question asking, responding to your. Uh, so we would look forward to seeing you in your further workshops, trainings, and have a great day. Stay tuned with our BIIHR.
Okay. I hope that it will what it be beneficial for you, whatever that area that you are in. Okay. And if you have questions, so you can ask me. Actually, to do the evidence-based practice, the piece of that, for example, to do the systematic review, you still need to train, and then to do the guide, to develop the guideline, also you still need to train also, because they have their own concept and the step to do that. Okay. Yeah, they have like rigorous method to do that. This is only introduce you the concept of that. Okay.
Yeah, ma'am.
All right. Okay. Good night, everyone.
Good
Thank you
night,
for
ma'am.
joining. Bye bye. Have a good
Bye,
night.
ma'am.
Thank you, ma'am. Thank you.
You're welcome.